Hello friends, today we will discuss our medical discussion episode number 41. Today we will discuss about sinusitis. So my first question is, what is paranasal sinus and what is the function of paranasal sinus?
So obviously sinusitis is a very important topic because many of the people that come in the OPD, they suffer from upper respiratory tract infection, and when we do a thorough investigation, we see that most of them they suffer from sinusitis. Actually, the paranasal sinuses or the sinuses that are present in our skull, they have a lot number of functions. These are some of the hollow spaces which are located in and around the nose. So they are therefore known as paranasal sinuses. The two most common sinuses are the maxillary sinuses, which are located on each side of the nose. There is also the frontal sinuses which are located above our eyes, and there is the ethmoid sinuses which are located in between the eyes. Also there are the sphenoid sinuses which are located behind the eyes. So these are the four most common sinuses which are affected by infection, which results in sinusitis. The most important function of the sinus is to filter the air we breathe as well as to humidify the air we breathe, so that the air that goes into the lung, it is humidified properly. Another important function of the sinus is that it helps to reduce the weight of the skull, because these are hollow spaces. It actually helps in decreasing the weight of the skull. So these are the most common functions of the sinuses or the paranasal sinuses. So whenever a sinus or the mucous membrane inside the sinus gets infected because of a lot number of reasons, we term it as sinusitis. Normally inside the sinus there is the mucous membrane which lines the wall of the sinuses, as well as there are certain hair-like structures which are known as cilia, and it helps to continuously clear the secretions which are produced inside the sinus and helps to keep the sinus hollow or empty. There is a ostia, or it is a small hole which is located in each sinus, and through this hole the various secretions it comes into the nasal cavity. That's why the sinuses always remains empty. The air from the nose also enters into the sinuses through these holes which are known as ostia. So the main reason behind the sinusitis is that either because there is closure of that hole which results in accumulation of that secretions, and ultimately it gets infected by the various organisms which enters into the sinuses. We will discuss how it gets infected. There are a lot number of reasons, but the main important thing to remember is that the reason behind the sinusitis is that because of any reason the ostia or the hole gets closed, as a result of which there is negative pressure inside the sinuses, the mucosa get hypertrophied, as well as there is accumulation of the secretions which ultimately get infected by various organisms.
Thank you, sir. Now we would like to ask next question, sir. What are the common causes of sinusitis?
Normally, the two most common causes of sinusitis is the upper respiratory tract infection and allergic inflammation. A lot number of people suffer from upper respiratory tract infection, that is infection of the nasal cavity or the throat or pharynx. So because of that infection, the mucosa inside the nose gets hypertrophied, as a result of which there is closure of the ostia. Because of allergic inflammation also there can be hypertrophy of the mucosa, and ultimately the person can land up in sinusitis. There are certain other causes like cystic fibrosis, or there can be ciliary dysfunction, which results in the disorders or non-functioning of the cilia, and as a result of which there will be non-clearance of those secretions and ultimately accumulation of that secretion. Tobacco or smoking is one of the most important cause which results in dysfunction of that hair-like structures known as cilia, and it ultimately results in sinusitis. Some mechanical factors like facial trauma or any injury to the facial area can also cause damage to the sinuses, which can ultimately land up in sinusitis. So a person who goes for swimming regularly, or if any infection through goes into the sinuses through the water in the while swimming, can also result in sinusitis. If a person has to be intubated, or if a person we give Ryle's tube through the nose, like that is feeding tube through the nose, it also can transfer infection into the sinuses, which can result in sinusitis. Another most common cause of sinusitis or recurrent sinusitis is the use of nasal drops regularly for a long period of time. We have seen people who has the habit of giving nasal drops continuously, and this results in sinusitis, which is known as rhinitis medicamentosa. Some other factors like deviated nasal septum, the bone which is in the middle of our nose, can be deviated to one side, and because of this disorder in the air entry can also cause sinusitis. Sometimes there is nasal polyp, or that is there can be hypertrophy of the nasal mucosa, which results in polyp formation, and it can block the ostia and results in sinusitis. There can also be presence of foreign body inside the nose for a long duration, and it also can result in sinusitis. So these are the very common causes which causes sinusitis in most of the people.
Thank you, sir. What are the sinus symptoms that can be seen in case of sinusitis?
Normally, when a person has infection inside the sinus, the most common symptom is the running nose, or there can be upper respiratory signs and symptoms, like there can be throat irritation, there can be upper respiratory signs, there can be nasal block. But if a person has recurrent sinusitis, or if a person has severe inflammation inside the sinuses, there can be facial edema, there can be facial pain, or there can be pain behind the eyes, there can be redness in the eyes, there can be recurrent headache, or a person can have even infection inside the ear there, which can result in hearing loss. Also, if a person has recurrent sinusitis, there can be postnasal drip, that is, the secretions from the sinus can go to the pharynx as well as the larynx, and can cause recurrent cough, as well as there can be severe infection of the sinuses, which can land up in infection of the lung, causing pneumonia. So these are the most common signs and symptoms that can be seen in a patient suffering from sinusitis. But the important thing is that if a person has sinusitis, sometimes he may ignore it as just upper respiratory signs and symptoms. That's why if a person suffers from these symptoms for a long duration of more than 4 weeks, he should immediately consult the doctor to rule out sinusitis.
Thank you, sir. My next question is, what are the diagnostics modalities of sinusitis and the treatment?
Normally, when a person suffers from sinusitis, there are certain investigations to be done to confirm it, as well as these investigations help us to rule out the various causes of sinusitis. The most important test to be done is the X-ray of the paranasal sinus, or we can go for a CT scan of the paranasal sinuses. Number one, it helps to find out whether the ostium is patent or not. It helps to rule out the various causes of sinusitis, like there can be deviated nasal septum, nasal polyp, hypertrophied turbinates. Also, it helps to find out whether there is any kind of accumulation of secretions inside the sinuses, or there is mucosal hypertrophy inside the sinuses. So this type of investigations not only help us in ruling the causes of sinusitis, but also helps us to find out how severe the sinusitis is. Moreover, if a person has fever, if a person has other infections, we should also go for other blood parameters like total count, if we can go for an X-ray of the chest to rule out if there is associated pneumonitis. Now, coming to the treatment, if a person has sinusitis for a long duration or recurrent sinusitis, the most important treatment is to treat the cause of the sinusitis. Suppose if a person has hypertrophied turbinates, if a person has DNS, if a person has nasal polyp, he should treat that cause first, then only the sinusitis will be cured. Moreover, if the ostia is blocked completely, a person can go for balloon dilatation of the ostium. moreover, if a person has recurrent sinusitis or the ostium is completely blocked, there is also some traditional methods where the bone is cut down and the ostium is made patent through which the secretions or the pus that accumulates inside the sinus can come out. So these are the various treatment modalities which we can go do in cases of sinusitis, but the important thing is that we should always rule out the cause of the sinusitis and treat it accordingly.
Thank you, sir. We have learned so many things today, how to treat, how to prevent. So at last, what you'd like to request the audience regarding sinusitis?
So sinusitis, it is a very common problem among the people. Sinusitis, if a person has recurrent infections of the throat, recurrent running nose, he should immediately rule out sinusitis, because if it aggravates or if there is severe accumulation of pus, then he may need operations in the long run. So if a person has all those symptoms that we have discussed, he should immediately go to the ENT surgeon, do the diagnostic test, and always rule out sinusitis as well as the various causes of sinusitis. I hope this video will be very useful to you all. Please like the video, share the video, and please subscribe the channel. Thank you all.